Hello students, today we have an introductory lecture, Relevance of a Problem, and involve the Nobel Prize laureate. The scientific medicine began with studying of infection diseases. Nakajima Hiroshi, the CEO of Huawei, repented global crisis in problems of infection diseases from which aren't protected neither poor nor rich any country, and nobody is able to afford to ignore them. Prevalence of infection pathology in the 21st century. Emergence of identification of new infections pathogenesis, emergence of infection episode of the infection which were considered effectively controllable, casual or intended distribution of pathogens of specially dangerous infection. Infective episode of specially dangerous infection. Hemorrhagic fevers, 2025 Angola, 422 cases of fever of Marburg, from them 356 with a lethal outcome. 2025 Timor Leicester, Leicester 25 Congo 2004 Congo 2004 Indonesia 2003 India 2003 Mauritania. Plague and tularemia. The first department of the general doctrine about infection diseases with a practical course of bacteriology was organized on March 23, 1895 in Medical Military Academy in Petersburg, St. Petersburg. The independent department of infection diseases without microbiology was created in 1923 in Aktubinsk State Medical University in 1961. Progress in fight against infection diseases. Creation of effective antibiotics, creation of effective vaccines, decrease in epidemics of plague, cholera, ticks, elimination of natural smallpox, considerable decrease in incidence of children's infections, reduction of lethality at especially dangerous infection by 10 times, and at some other by 100 times. But still, infection diseases on of the learning reasons of incidence and mortality. According to who data whole in the world, 15,020 people die of infection diseases, from them more than a half children till 5 years. Infection episodes of infection diseases in 2009. Diseases: meningococcal infection, dengue fever, enterovirus infection, yellow fever, cholera, Ebola fever, bird influenza. Among infections, the special concern in caused viral hepatitis, tuberculosis, HIV infection, slow infection, intrahospital infection, bioterrorism. Run of some infection diseases in Republic of Kazakhstan. Morbidity of chronic viral hepatitis in Republic. HIV, IDC. Evolution of infection process. Growth of long and chronic forms of infection diseases, more frequent development of mixed infection, superinfection, updating of opportunistic pathogenic microflora, intra-hospital infection, increase in frequency of mucoses, increase of a role of an infection in various areas of clinical medicine, growth of specific weight of a viral infection. Infection diseases of migrants in Republic of Kazakhstan, HIV infection, tuberculosis, STD, viral hepatitis, acute internal infection, and other infection. History around infection problems. 100% lethality rate, HIV infection, prone illnesses, and other flow infections. There is on effective treatment against 3 infection diseases: HIV infection, hepatitis C, herpes simplex. Difference of infection diseases from the somatic specificity, contagiosis, recurrence, immunogenicity. Infection diseases have the difference and are independent and ancient sciences. Infection process, complex of the mutual adapted reactions in response to introduction and reproduction of a pathogenic microorganism in a macroorganism referred on restoration of the blasted hemostasis and the biological equilibrium with environment. Microorganism rule. Pathogenicity, specific property of all microorganisms, which characterizes its ability to get into a human body or an animal, to use its habitat, and to cause pathological changes in organs and tissues with disturbance of their pathological functions. Microorganism rule. Virulence is the property of the concentrate strain of a pathogenic microorganism, characterizing degree of its pathogenicity. According to the degree of pathogenicity of microorganisms are divided into saprophytes, opportunistic, the pathogenic. Pathogenicity of a microorganism is caused invasiveness, ability to adhesion, ability to a capsule formation, to intercellular parasiting, to formation of an endotoxin, to formation of exotoxin. For formation of infection process, the infecting does and the ways of penetration into a microorganism have essential value. The minimum infection dose and the minimum quantity of the microbial bodies capable to cause infection process fluctuates from several tens to several million. Microorganism rule. The, the susceptibility of a microorganism is different and genotypical feature. The reactivity change caused by action of factors of environment. Protective mechanism of a microorganism, external barriers, internal barriers, cellular and humoral mechanisms. Forms of infection process, infection carrier, latent infection, infection diseases, autoinfection, reinfection, superinfection, mixed infection. Infection disease is a group of illnesses which cause specific causative agent are characterized by infectivity, cyclic surround and the formation of post-infection immunity. Post-infection immunity. The term infection diseases was interned by Duffelet. Disease implication periods, the incubation periods, the prodromal periods, height, fading, early convalescence, convalescence. Diagnostic complaints of the patient, anamnesis of diseases, epidemiological anamnesis, results of survey, the laboratory methods, the instrumental methods. The characteristic of a birth at infection disease, chickenpox, things, skin lesions, meningococemia, basal flushing, hyperemia, preference of the face, bandaging, infection of sclera, conjunctivitis, rhesus sardonyx, epistotonus at the child, angina, anginose from regional lymphadenitis, archids, brucellosis, septic, metastatic, zoonotic dermal, leishmaniasis. Symptoms of digitization. Thank you for your attention.